Israel has maintained that Rafah is where members of Hamas are right now. But remember, over 1 million Palestinians have been moving to Rafah to get away from the military bombardments. And now the only functioning hospital there says a 4-month-old baby is among the 35 bodies sent there in the last 24 hours. We also know World Central Kitchen has stopped operating there in Rafah due to Israel's evacuation order. Israeli Defense Forces have ordered an estimated 100,000 people to get out of that area. The IDF has closed the critical crossing in Rafah that goes into Egypt after taking over the Palestinian side. And right now, the State Department has just said that they do not see trucks crossing through Kerem Shalom, the other entryway for aid into that area. Joining us now is Deepmala Mahla, the Chief Humanitarian Officer for Humanitarian Organizational Care. Thanks so much for being with us today. You have been clear that you believe a military operation in Rafah would be devastating to the over 1 million civilians who have gathered there. Help people understand why.
We have been very clear, and we have been saying it for months. We are talking about more than 1 million people cramped in a really small geographical area. When we talk Rafah, Rafah is a quarter of Baltimore, let's say. And most of these people, most of them do not have enough to eat. They are facing malnutrition. Some are even near starvation. The health system has completely collapsed. People are living in tents with situations where there is no clean water, no toilets, no facilities for women to deliver their babies or nurse their children. And all this has been happening over the past few months. So the scale of humanitarian crisis, the absence of basic services, and the overcrowding, also disease outbreak. In this situation, if a military offensive happens, it would be a disaster of monumental proportions. And as it is happening now, there is an absolute sense of panic, disbelief, and sheer palpable horror among the people living there.
And I want to quote a Gazan who actually just left Rafah, who evacuated Rafah. He told CNN, quote, that his family has been displaced several times and has been forced to eat animal food and walk on streets littered with dead bodies. You have colleagues who are there who are witnessing this as well. What are you hearing from them about what they're seeing on the ground?
So the saddest part is this hugely sad quote is not a single story. There are many millions of people have these stories. We have heard of things like women trying to mix expired soda water into baby food to prepare it for their children, people having to drink water from the ditches, not changing clothes even once over a span of 3 to 4 times. Now we are hearing people are trying to leave Rafah on foot, babies carrying babies with whatever belongings they have. And there is starvation. We know of starvation related deaths, but let me say one thing, as sad as it sounds, between starvation and death, there is usually disease. And there is nothing left to address that disease and give people any sort of medical aid. It is absolutely horrific when we talk to our colleagues and partners on the ground. It's sadly so common to hear wails and screams of children, women. And I must say one thing, Jessica, I never thought in my life I will use these two words together, but it is a reality in Gaza. Pediatric amputees.
And
Pediatric amputees, the highest ever number ever recorded in history.
And you told CNN that you believe Israel's military operation is obstructing aid into Gaza. As I just mentioned, we did have a new update that the U.S. State Department is saying that it still has not seen aid trucks or trucks crossing into the reopened Kerem Shalom crossing in Gaza due to logistical and security concerns. What do you think can be done to get more aid into Gaza right now?
There is only one answer. There is only one answer. Open the border crossing. Let the hundreds and thousands of trucks, which are in queues, loaded with life-saving assistance waiting to get in. Rafah is not only a border crossing, Rafah is a lifeline. It is a lifeline for millions of people. So choking that off and choking Karim Shalom. In the last few months, most of the aid has come through Rafah and Karim Shalom has helped. And when these are choked, which means everything is blocked. No aid comes in, no aid workers come in, no medical workers come in, and no medical evacuations happen. Yes, the news about Karim Shalom opening is welcome, but it is not clear if aid will flow because we have not heard of any update about trucks/aid coming in from Karim Shalom. Even if that happens, regardless, the lifeline is Rafah because the scale at which trucks and medical aid and humanitarian aid is needed, we need an opening like Rafah. And there are several other crossings. The northern part of Gaza is on the brink of famine. People are dying due to starvation, dying as we are speaking. Kids are dying. Newborn kids are dying. I have heard of stories about when a child was born and then died before any registration could be done, as if the baby never ever existed. In the north of Gaza, there's a crossing called Erez, which means we have the possibility of bringing aid into Gaza to save lives through the Erez crossing, but that is blocked. Open the border crossings, let the aid in, don't kill humanitarian workers, protect civilians and civilian infrastructure, and release the hostages.
Deepmala Mahla,
Can
thank you
we
so.
save all the
Oh,
lives which are on the brink of? Sorry, I
no,
was saying, do we still have the time left to save all the lives which are on the brink now? Perhaps not, because things have reached that far. So I say this to convey how urgent the situation is for a ceasefire, for letting aid in, for releasing hostages.
thank you so much for your update there and for speaking with us. We appreciate it.
Thanks for having me.